Awesome. We are going to start with the first presentation, which is Student Leadership in an Interprofessional Peer Teaching Group.
Hello, everyone. My name is Colleen, and I am a senior medical biology major.
And I'm Carolyn, a senior applied exercise science major.
Each fall, the IHS 130 Interprofessional First Year Experience course is taught to first-year students in health professions majors to introduce them to the healthcare field and support successful collegiate transition. Peer teachers are upperclassmen students who co-teach the IHS 130 course with their partnered instructor. Carolyn and I worked together last semester as co-lead peer teachers. As lead peer teachers, we collaborated with a faculty member, Colin Bader, each week to provide continuous support to the peer teachers. By sending out weekly communication and hosting monthly meetings, we served as guidance for peer teacher leadership development and in turn supported the first year students' transition to the first year of college.
To give a bit of background, Colleen and I both had previously been peer teachers in the classroom setting. We had some previous knowledge of the nerves of standing in front of the classroom as a student for the first.
Hello, everyone.
Sorry about that.
To lead some students who were not grasping the full concept of the information being presented. By discussing with Colleen and I and the rest of the peer teachers, we were able to create a list of alternative solutions to try and help the scenario.
Which brings us to the main objective of us sharing this project. The importance of having support through any transition, especially in our setting where we are attempting to reach the main three goals of success in college for all: preparation for the healthcare force, and knowledge of self and others. Develop professional skills, cultivate campus connections, and of course, develop wellness practices for a balanced lifestyle. Exploring the process of team development and practices for effective collaboration. Enhancing knowledge of learning styles, personality types, and emotional awareness to promote success in academic endeavors and relationships.
In the middle here, you can see a diagram emphasizing our goals and how we achieve them through the interpersonal connections. We mentioned some of our forms of outreach already, but as you can see there, we also held an orientation to help our peer teachers adjust into their roles and hosted an ice cream social for our peer teachers and all of their students to attend so they could grow that bond together. Throughout all of this, our methods proved to be having that effective communication available 24/7 to all students involved in the program, surveying our peer teachers to ensure that they were getting what they wanted out of the role, and really promoting self-reflection to develop however fit for that individual.
We help develop them as leaders through reflection of their individual experiences, by having them elaborate on what they learned and how they pushed through any challenges. Therefore, everyone could uniquely grow in their own experience. Although we had a successful semester with our group of peer teachers and one another, we have continued to work with faculty to revise the IHS curriculum to give students perspective to help them enhance an interactive and engaging learning environment for future students. This is because we gained so much knowledge from the peer teachers and how just some minor adjustments to the classroom agenda could make the learning outcomes of the course so much more fulfilling for all of the students.
Yes, we will help do this through promoting the use of speakers, creating a case study, and more.
To close, we would like to thank Colin for all of her help in making these roles fun and so successful. She allowed us to really take the reins and help us navigate how to make our ideas come to life.
Her passion for wanting to help all of her students really shows and is something that Colleen and I will both take with us into our future careers.
Well, thank you so much. Thank you, Megan, for playing that video. Thank you so much to Colleen and Carolyn for that excellent presentation. We now have a few minutes for discussion, about 5 minutes. So if you feel comfortable unmuting, sharing your video, and asking questions that came to mind, we have Colleen and Carolyn here who are ready to answer any that you have. So what questions, comments came up? Yeah, I see one from Professor Hessman.
Hi, thank you. Thank you both for that presentation and for the work you did with the peer teachers this semester. I'm just wondering, being that you work together in this co-role, leading the other peer teachers, I'm wondering what were some of the successes and challenges that you experienced as co-leaders in that role?
I think that we had a lot of success with like growing our relationships with the peer teachers. That's something that Carolyn and I worked throughout the semester with Colin. We would send them monthly emails and we would like kind of message them over GroupMe and have them reach out to us if they had any questions for us. In addition, we also had monthly meetings where we had a little pizza night, so that was always fun. Just to kind of talk about how things are going, how we can help them. So I think that was one of the most successful things that we came across.
And I would add on that something maybe difficult, but also just different for both of us was that we both were just peer teachers prior to the lead peer teacher role. So kind of being on the outsider perspective and hearing about things that were going right or wrong, and not being able to like be in the classroom and actually experience that and just kind of give advice based on what we're hearing, which can only go so far. It's kind of up to the peer teacher to actually implement that in the classroom. So I guess was kind of a challenge to like give advice, but still have to go back and forth and not actually get to be in the classroom and kind of take action ourselves. Thank you for the question.
Yes, thank you.
Yeah, great question, Professor Hussman. What other questions do we have for Colleen and Carolyn?
So this is Kelly Fox. I'm a faculty with the School of Social Work. I'm curious about, how this experience how you will take this experience and what you learned out into the world. I see that you're both graduating, so congratulations. So I'm just curious, what have you learned that you really think will help you in your career moving forward?
I think that, kind of what we see in all of the CECE presentations is the goal of just kind of getting to work with people of different majors and stuff. I know personally for Colleen and I, we had a whole normal freshman year and we got to meet a lot of different people like in our majors and not in our majors. But then sophomore, junior year, where we had the pandemic and stuff, I think going online and kind of not getting to meet as many people out of our major more so than ever, because even people in our major we didn't get to meet in person. This opportunity provided both of us like a great thing where we got to meet not only people of different majors, but also different ages, people from different backgrounds, people with different goals. And I know you switched majors at some point, so maybe you could touch upon that and how we got to meet a lot of different people.
Yeah. So I actually started off in the nursing program. I was very involved, but I got involved in a microbiology research lab on campus and found myself just loving microbiology and immunology. So I decided to switch my major to medical biology. It was definitely a tough transition because I was very nervous, but I think being able to kind of take the College of Arts and Sciences and also the Westbrook College of Health Professions has been super helpful because I've been able to engage with different faculty from both colleges and kind of be able to merge both of the core values from each one of those.
Thanks so much for the question, Professor Fox. Thank you so much to Colleen and Carolyn for that amazing presentation. We're just almost at 12:20 now, so I think it's about time to transition to our next video presentation. I'll turn it over to Megan, and then we'll have another discussion following that.
So we are an interprofessional team that work together to discuss and treat a patient suffering from long COVID. We came in at the beginning of the project with our biases of how each profession worked and saw how those changed throughout the entirety of the project. So some of our biases for pharmacy, thought the pharmacist kind of deals with facts and drug interactions and indications. PAs in charge of history taking, providing basic line of care. OT does the fine motor skills, upper extremity therapy, primarily ADLs and rehab. PT is kind of the gross motor movement and strength building with some overlap with OT. Social work helps patients and family transition from hospital life back to home life, and they provide some resources. And medicine is the director of the group, solely focused on medical care of the patient.
So how did our biases change throughout our experience? So for pharmacy, we realized that they're very involved in the entirety of the patient care. So they take a lot of different factors into consideration, such as the family and the living situation of the patient. the physician's assistant are really well versed in treating the patient as a whole and discuss what the patient needs outside of just medicine. The OTs focused on patients' mental health and innovative care, while they created a starting point using objects in the home to improve their cognitive training. PTs worked with items in the home to ensure the safety of the patient and gave them simple instructions to work on endurance training. Social work was the great motivational speaker of the group and focused a lot on the mental health of the patient and provided reassurance and validation throughout the process. And then medicine was a holistic approach and discussed mental and emotional health of the patient while taking into consideration their medical needs and examinations. So now what? Through this experience, each one of us were able to learn a lot about our individual biases. And as we came together for the sole purpose of treating and caring for Amanda, we began to see the overlap each of us have and learned our roles in a new way. And we're able to see other people's ideas as well as our own, and really work together to come to treat Amanda in a holistic way.
If that group wants to share their screen so we can see them, and if anyone has any questions for this group, you can go ahead and ask them.
Yes, big thanks to this group for an excellent presentation. And yeah, I'd love to hear questions from our audience, questions that came up as you were listening to their project.
I think I have a question for this group. Oh, there's 2 hands raised too as well. My question is, I know as an OT student, lots of times we're provided with the opportunity to educate those that we're working with on what the role of OT is. So I'm not surprised to see that discrepancy, but for the other healthcare majors that were there, was that your first time experiencing kind of a discrepancy between what your peers thought your role was and where your responsibilities were, or have you experienced that before, and how did you maybe navigate it differently this time?
Hi, I'm Jessica. I'm a DPT1 student. So for me personally, I always did see the overlap of OT and PT. And even my mom, who's been a nurse for 30 years, always goes like, OT is upper body, PT is lower body. And I was like, no, that's a concept that's like very different now. I do feel that stereotype is still there. But for me, I just like to kind of state that although there are overlaps, there are other things that we're specifically looking for. You know, PTs also help with ADLs, OTs also help with gross movement. And it's just really knowing what the patient needs and being able to address them in that way. But I do think that it's still definitely more of a collaborative effort. And that's just kind of how I explain things when there's a lot of confusion between the two.
Thank you.
Yeah, thanks so much. And I know I'll turn it over to, we have at one hand, so please feel free to jump in with your question.
Thank you. Hi, I'm Rostea. I'm a first-year comm student. I was just wondering how long it took for you guys to realize that you had overlapping approaches to care, and then how possible do you think it would be to kind of incorporate this more in the healthcare field as a whole?
For us, it was after the first time we met with Amanda, right before we went into the second portion of the first day. We were all, as we came together to do a debrief, we're like, oh, so they had similar questions that we wanted to ask. And we also were able to see that not one specific, I guess, practitioner are going to ask different questions, if that makes sense at all. But it was, you know, things that for me as a PT, those are the questions that our social worker was asking, are things that I would have asked, you know, things that of their medical history, of just knowing like medications and stuff, were asked by both pharm and the doctor. And I think in order to kind of integrate this more into our current medical system is to just keep being educated on all these different aspects of it. It's just because I'm a PT student doesn't mean that my knowledge ends with the gross motor movements. It is important that I'm getting pharmacology in so I can understand the medications my patients are on, or, you know, being able to talk about motivational interviewing and getting those kind of core foundations. I think mainly educating it and the student also wanting to learn it, because I think that's so important, not just being like, oh, this is like a fluff class, but no, it's really important when we're getting out into clinics and being able to talk to our patients and understand what they need.
Thank you.
Yeah, thank you very much. I know we have a question that came in through the chat, so I'm going to read that off now. So the question is, do you feel that the chronic aspect of care featured in this is more facilitatory of interprofessional collaboration? Do you think that care in an acute setting would have been better or worse for learning roles and reducing personal biases?
Oh, that's a great question. I feel that definitely the chronic aspect was really helpful for this interprofessional collaboration, because if I think of different patients I've seen or just have heard about, you're not getting a lot of the collaboration between different professions, because you're like, they're in ICU, only the medical staff are really going to see them. But if the medical staff starts to see, oh, this person will be a really great candidate for PT or OT, that's, there's almost like a chain of command. However, doing this and being able to approach it from all these different almost perspectives of the professions was very helpful. I think if it was in an acute setting, I feel like that's a little hard, because if it's in an acute setting and we're seeing somebody, in something like a nursing facility, then you definitely have more of that interprofessional roles. But in an acute setting for just a hospital, I think that's much harder, because then their main focus is, let's make sure she's stable, let's make sure that she's able to do more before she gets put with like a PT and an OT for just like ADLs or more movement. But I think an acute setting would have been a little bit harder to learn about like our roles and biases, because it kind of comes down. We'll get all the information from the medical staff, and then whomever is next will get information from there. Whereas this was definitely so collaborative on like what we wanted to ask, where we wanted to go with it. And I have 1 minute left. So did that answer your question? Sorry, I felt like I talked so much.
No, that was so helpful. Thank you so much for those excellent questions and all that detail, Jessica. We really, really appreciate it, and another amazing project. So I think at this point, with that 1 minute left, it's a great time to start transitioning to our next presentation and our next video. But thanks again, that was wonderful.
Hi, I'm Danielle Clymer. I'm an AES pre-med major.
Hi, I'm Stephanie Burns. I'm a health, wellness, and occupational studies major, and we did our IP project on fetal alcohol spectrum disorder awareness. So first, we want to start off by defining what is fetal alcohol spectrum disorder. FASD is a birth defect that occurs when a person is exposed to alcohol. Prenatal alcohol exposure causes a range of adverse physical, neurocognitive, and behavioral effects. So for our project, we created a brochure that was targeted towards healthcare professionals and families impacted by FASD. And our brochure's purpose was to educate and bring awareness about FASD as well.
There are a lot of common misconceptions about FASD. One is that facial abnormalities are a common sign of an FASD diagnosis, but actually it is only seen in 10% of people with FASD. Also, another misconception is that all healthcare professionals receive proper education and training about FASD, and that is not actually true. They receive little training regarding FASD diagnosis. The prevalence of FASD, 1 out of every 20 children in the US has FASD, and that is 10 times greater in children in foster care. In order to get an FASD diagnosis, the patient must have prenatal alcohol exposure and central nervous system or brain abnormalities. The importance of treatment is important to conduct a FASD diagnostic evaluation from birth to age 3 to document alcohol exposure in the medical record and begin early intervention, and reevaluate at age 8 to update the diagnosis, And some predictors of positive outcomes include early diagnosis and intervention, as well as a stable and nurturing home environment. And what happens to families if they do not get in FASD diagnosis? They're 17 times more likely to attempt suicide. Almost 50% experience problems related to alcohol and drugs, and they have legal trouble at a younger age, which may result in incarceration or time in juvenile detention.
So within FASD diagnosis, there are 8 areas of occupations that OTs focus on that are impacted. So some deficits that are impacted are adaptive functioning, severe executive functioning, attention, and memory. Also sensory overload, average or low IQ, and learning disabilities, as well as sleep disorders. Our goal is to spread awareness about FASD diagnosis across an interdisciplinary field of healthcare providers, leading to a decrease in misdiagnoses and an increase in treatment and therapies. At this time, we'd like to thank our faculty advisor, Karen Hussman, as well as Valerie Jones, Kelsey Teagan, Shelley Cohen-Conrad, Colin Bader, and Bethany Fortier for all your help.
Excellent. Thank you so much. So I'm going to ask the presenters to share their video so we can see them and engage them in a discussion about their project. So as you were listening and learning about the project they did, audience, what questions came to mind that you want to ask the presenting group? Yes, I see a hand. Go for it.
Hi, I was just wondering if you guys have any ideas on the best way to approach teaching this so that it is interdisciplinary and not just taught in each separate profession.
I would say, especially since it is under like appreciated and undereducated upon, like being able to address it across all areas in a manner that affects everybody who's working together. So I think, like, for example, I'm an pre-occupational therapy student going to OT school in the fall. So I think, especially me, like I can be working with PTs, OTs, really anybody. So just being able to approach it in a manner that is effective through everybody, because we all have different approaches, but as long as we all have the same like basic background information, I think would be crucial.
Just adding on to that, I think since interprofessional care is so important with all the different symptoms that come with FASD, I think just making sure everyone is on the same page with the basic knowledge, like Steph said, but also everyone bring their own perspective on how best to help the patient.
Thank you.
Yeah, excellent. Great question. Thank you so much, Danielle and Stephanie. Do we have another question or comment, an idea from someone in the audience? Yes, Professor Hussman.
Yeah, I think this kind of follows on the heels of Ostasia's question, and that is, so you've really identified that FASD is a diagnosis that few people know about or understand. It's largely misunderstood. So how would you suggest, if knowing what you know from your undergraduate education and getting ready to move on to graduate education, how would you recommend that educational programs ensure that they're teaching about these under-identified diagnoses?
So personally, in the HOAS program, we take a substance misuse and prevention course, which I think it would be very beneficial if we went in depth about fetal alcohol spectrum disorder, or even just like touched upon it and like the basic of understanding what it is and how prevalent it really is, and like the misdiagnosis and stuff. Because in my class, there are people who are not just going for OT, so that would come across through multiple professions. So that would be my suggestion, to just implement it more in like core classes, as well as like anatomy and stuff like that.
Adding on to that, I think in my studies, the first time I really heard about FASD was at the CECE event. So just having more events like that bring information about diagnoses that aren't talked about in the core classes, and just making sure people are able to get that information.
Great. Thanks so much for the question. And thank you both, Stephanie and Danielle. And we have time for one more question from the audience. If anyone has something that came up in their minds as they were watching. One thing I was wondering if you might be able to elaborate on is just what the interventions look like for those who are diagnosed and how that mitigates all those negative outcomes you presented. How effective and how successful are the interventions at promoting more positive outcomes?
So the main two things we found to be most effective is a stable and positive nurturing home environment and early diagnosis and early intervention. So starting at that younger age, but what is happening because there's like a lack of education and a lack of training is people are getting misdiagnosed. So since they're getting misdiagnosed, they're getting mistreated as well. So for example, a common diagnosis is oppositional defiant disorder. So getting treated with a defiant disorder, you're getting treated for a defiant disorder. You're not getting treated for FASD. So being able to get education on diagnosing properly would most likely be the first step so that the treatment correlates to the proper diagnosis.
All right, excellent. Thank you both. It's about time, about 12:40, about trying to transition to our next presentation. So I'm going to turn it over here to Megan.
Okay, we're going to get started. This presentation is on LGBTQ health, effective training for interprofessional emerging health professionals.
Study find that cultural competencies in healthcare practice with LGBT patients is significantly lacking across health professions curricula. LGBT patients are vulnerable to informed care as well as to biases and discrimination that, as a consequence, may result in healthcare avoidance and or poor outcomes. Further, lack of knowledge regarding LGBT health contributes to practitioner discomfort and low confidence when addressing LGBTQ needs. The goals of this event was to raise awareness of distinctive features of LGBT health needs and increase knowledge surrounding the health needs of our patients.
The event was hosted on Zoom and included an educational part and a discussion part with breakout rooms. 40 student leaders from all professions were asked to serve in the breakout rooms as facilitators to guide conversations. There was an attendance of 76 students and faculty from different health profession programs at the event that were split into 10 breakout rooms. Prior to the start of the event, participants were asked to complete an 18-question survey known as the LGBT DOCS, which stands for Development of Clinical Skills Scale. This is a validated tool for determining changes in self-perceptions of attitudes, clinical preparedness, and knowledge of LGBTQ+ health. After the educational session, students were once again asked to complete the survey.
An unpaired t-test was done on the responses of the overall LGBT DOCS score, as well as the subcategories in clinical preparedness, knowledge, and attitudes. As seen in the graphs, the overall knowledge and preparedness sections had significant increases in the scores. However, the attitude section did not. After the event, the interprofessional student group members discussed different approaches on including LGBTQ+ education in their professions. They discussed incorporating LGBTQ+ care into simulation patient experiences, providing appropriate education on gender-affirming practice, including mental health treatment in LGBTQ patients, and then including occupational therapy in incorporating aspects in activities that provide gender-affirming care.
Many health professionals lack adequate training to provide comprehensive care to the LGBTQ population. This study was done to further explore the attitudes of healthcare professional students after attending an educational event focusing on providing interprofessional care to these populations. Using the survey, it was found that after the event, there was an increase in overall survey scores as well as significant increases in both preparedness and knowledge categories. These results would indicate that events about LGBTQ care would benefit health profession students in preparing them for working with this patient population.
All right, excellent. Another wonderful presentation. Let's get some questions from our audience. Audience, what questions do you like to ask the presenting group? Yes. Mike Sheldon, go.
Hi, Colin, how are you?
I'm good, how are you?
Good, great presentation. So my question is, and I'm not familiar with the survey tool, do you get to the granularity about, you know, one thing, it's, oh my gosh, this is going to be something that I'm definitely going to incorporate, like the big learn, you know, the take home? Were there a couple of things that came out that people said, you know, I had no idea about, but this is great. I'm going to add this to my toolkit.
Hi, I'm Ostea. I'm a first year comms student. So I think that the event, people had to register for it. So I think it kind of goes both ways. So I think everybody who registered for the event and did go are people who are actively trying to learn about this topic and learn more. But I did hear from several students after, between several professions, that they did learn stuff that they hadn't heard about before. Does that answer your question?
If I could say something, I was one of the student leaders in the breakout group. And one thing that I heard and one thing we discussed in the follow-up was simple things that people could carry through were respecting people's pronouns. And then even before that, kind of encouraging their practices or where they work to start including that on intake paperwork in a way that wouldn't signal anybody out and not have like preferred pronoun, but just be like, what's your pronoun? What's your, gender? Maybe multiple choices, maybe just blank so you can write it in, and having your legal name and then your desired name, something like that, so that it would take some of the awkwardness out of having people being like, well, I think they might be something, but and I have it across the board. So that was a big takeaway, I think, for people.
Yeah, I would agree with that. I think there was a big focus, I'm Austin, by the way, on passive ways to make sure that you are being as inclusive as possible, because a lot of times those are the things that can make a difference in those first few minutes. If somebody comes into your office, especially as a new patient, how can you create a setting that is not overt or over the top, but that it makes somebody feel comfortable coming in no matter what their background is. And so there was a lot of discussion about just simple things such as intake forms or just reading materials, ways that you set up the room to make people feel more comfortable, what kind of restroom access you have. Those are little things that you can do that can go a long way in setting the tone to make the LGBTQ plus populations coming in feel comfortable and willing to hopefully not already kind of have like their guard up before they even get into the room with you. So that was one of the big takeaways for me, at least, was trying to be more cognizant of trying to find those areas where you can just make those little things happen to make a difference.
Thank you.
I'm Sarah, and I was another student facilitator. And a takeaway from our breakout rooms was understanding that patients may have had past traumas or negative experiences that would make them hesitant to engage in healthcare. And so addressing that and making it a safe environment psychologically and physically, but also recognizing that somebody's walking through the door and they may have had a really negative opinion of healthcare workers in the past. And so that might be present in the care.
Hi, I'm Evelyn, a PA student, one of the students on the team. The takeout in the breakout room was like, if we have, as a provider, we are well trained and know exactly how we're going to approach the patient clinically, then that discomfort will lessen and the patient will not see it through us taking care of it. It will feel that comfort, and the patient also will feel like, okay, I think I'm accepted here, and the provider really knows what she's doing or is doing.
Hi, and I'm Emmy. I was another facilitator in the breakout rooms and a part of this project as well. And something that really stuck out to my group during the discussions were just, like Austin was saying, how little things go a really long way. And how we can work together as providers, as healthcare professionals, to educate each other and ourselves, and just really be intentional and put in effort to make sure that everybody that we are seeing is getting the best care that we can provide.
I think all of those are some really strong takeaways. and were really important for everyone to hear and understand, especially because this is such an important topic to truly understand and have the knowledge around, especially as future healthcare providers. So thank you all for sharing that. We're going to move on to we're going to wrap up this one and move on to our last presentation. But before we do that, I'm going to drop into the chat a link for our attendance. So if you could fill that out before you leave today, that would be awesome. And this presentation is on peer health education.
Hi, I'm Hannah Hutchins, and I'm a health, wellness, and occupational studies major.
I'm Michaela Svensson, and I'm also a health, wellness, and occupational studies major.
And my name is Madison Willis, and I am a medical biology major. So for our project today, we participated in the Peer Health Educator program. This program is designed to promote healthy choices and lifestyles through educating the community on campus with a variety of different topics. Because we are students, we are readily available in providing a more comfortable and laid-back environment for our peers to express their concerns and feelings regarding health. Peer health educators can provide non-judgmental support, act as a resource, role model, and referral agent. Some areas of focus include stress and time management, nutrition, fitness, sleep management, and many more scopes of health.
As for the process of Peer Health Educator, we participated in a 12-hour foundation training, and it is broken up into 8 modules, which we went through, and they include some areas such as understanding change and the roles of peer educators, as well as being an effective listener, and how to be a responder. Some trainings that we went through as well were bystander interventions, how to assess interpersonal applications of identity, programming strategies, as well as group development. And students who are certified in this training have been trained in the core skills that will make them a better leader, role model, activist, and team member.
For our assessment, we collected data from UNE undergraduate students. So we sent out a survey just to any undergraduate, no matter what their major is or age or anything. And the survey focused on the health and wellness and how it correlates to different events that are put on through the UNE campus. We sent out questions such as what students were most interested in gaining knowledge in, and that came out to be that students were most interested in gaining knowledge on nutrition and stress management. We also asked what their biggest limitation was when it came to attending these events, and they said that they did not have enough time within their schedules to go to these events. Another thing that we asked was what wellness issue they thought needed to be addressed more throughout the campus. And the most common answer that we found was that mental health needed to be addressed more, and there needed to be more resources provided to students at all times of the day and week for students to be able to address their mental health concerns.
So when discussing applications for future health profession, I am a medical biology major and future public health professional. Peer health education is a really important stepping stone to the public health career in particular, because both promote health education. In public health specifically, I would like to work in the scope of addiction crisis. And within this training, we did learn risk management within addiction and other habits as well.
So in the field of occupational therapy, which Hannah and I as future occupational therapists will be using peer health education in a large portion of our work with future clients, being able to provide resources as well as being able and comfortable to respond properly to people's intense emotions and feelings during these times in our life is an important factor that we will be using in our futures.
Wonderful. Thank you all for another excellent presentation. So again, I'm going to just turn it over to the audience and presenters. If you don't mind showing your videos, that would be wonderful. Audience members, same for you all. What questions came up as you were learning about the Peer Health Educator program? What questions do you have for these presenters? Yes.
Go ahead.
Hi, I just had a question. How do you suggest like the school and faculty adjust schedules to incorporate these concerns that undergraduate students had with incorporating wellness?
I think a large portion of our project that we did was mostly about advocacy as well as education. So I think professors being aware of these aspects that students are concerned about would probably play a big role in being able to incorporate these into students' daily lives and being able to touch on these areas of wellness that students are so dedicated and feel as though they are so important to them.
And to add on to that, I know that in orientation and first year experience and all those, you learn a lot about the areas of health and wellness, and specifically for Michaela and I's major, it's health and wellness, and we do learn a lot about that, but I don't think the other majors have as much opportunity to really learn about it, especially like other science majors, such as obviously we have a big like marine and environmental science, and they don't really see that aspect of health and wellness. So even just in our first year experience classes, we learned so much. So maybe giving students the opportunity just to like get to know about that and learn more about it, just not within first year and as we move up in like school.
Oh, I am the outlier. I'm the med bio major, and I didn't have to take a first year experience class. So for my major, a lot of people, I feel like it's the health and wellness is overlooked. It's just like pushing for classes and stuff. So I think we talked about this during our training, like maybe the integration of something like a first year experience class for everyone, just so the importance of health and wellness for every major is emphasized. So just like Michaela said, just advocacy and pushing for more focus on that is really important.
Great question, and thank you all for elaborating there. Other questions or thoughts or comments from our audience here for this group?
I have a question. I know how you said that only certain majors have the first year experience course. If it's not able to be put into all of the curriculums of the different programs, do you think that it would be beneficial for during orientation or when students are first becoming acclimated to uni as first years or as transfer students that a session on health and wellness be built into that orientation time period? And if that would address some of the needs that students who don't get that first year experience may get.
Yeah, I think that's a really important aspect. I know they do, Erin Neptune actually does do a whole section during orientation on health and wellness. She does a waves of wellness activity that all the students fill out all of their aspects of health and what level they're at, how they're feeling. And she takes those and kind of evaluates them, sees where students are at. And I think if we were able to do more of a follow-up as students go through college to kind of continue to see where they're at, where they might need support in different areas, that would be a great change and kind of an integration that we could have. And it doesn't need to necessarily be into a class, but just having that as an option and making sure that that's more advertised, that students know that that's available for them.
When we were looking at the survey results as well, a lot of people found like we stated, mental health was such a huge issue and the counseling services at UNE. So putting more emphasis on those, even just as a first year, second year, and as like obviously school gets more stressful as you are going up and like applying to grad schools and stuff. So you could have like the go in and out mental health issues, and having that support and like knowing where to find it, I think also was one of the bigger issues. People not really knowing who they can go to, say they don't need to go to like an actual counseling service. But Erin Neptune, who we did our peer health education program with, she like is really helpful with that, and not a lot of people know her name. So I think even just getting her name out into the community would help a lot.
Thank you guys for answering that question and all of your questions. I think that was really helpful, and I definitely agree. I did the peer health education course in my undergrad, like you guys did, and I'm happy to see it. When I did it, it was just HOA students, so I'm really happy to see that it's starting to branch out more and more students have access to it, because we all will be healthcare professionals as well as like individuals, and having those critical active listening skills is really important in all professions. So I'm really happy to see that it's expanding. But that brings us to the end of our poster session. Thank you all for joining and presenting, and for our faculty mentors who joined and participated, as well as people who were just viewing. If you fill out our attendance, that would be lovely. I can drop it again in the chat. But that concludes our session. Is there anything you want to add, Colin?
No, that was wonderful, Megan. Thank you all for being here. Definitely fill out that attendance survey. That data is really helpful to us. We really appreciate it. And thank you to all of our amazing presenters for all your inspiring work this year. We are really proud of you all.